A professor is enjoying his lunch that he quickly prepared this morning. He notices his chicken is a little chewier than normal, but finishes his plate nonetheless.
1 hour later.
While waiting for his class to arrive, the professor notices pain in his stomach and is feeling very chilled. As he stands up, he becomes very dizzy and weak. But after a moment, realizes the pain in his stomach has turned to nausea. Suddenly, he rushes to the trash can and begins profusely and violently vomiting. A student walks into class and sees the professor slouched on the floor with pale skin, holding a foul-smelling trash can. He realizes this is an unusual-looking scene, an unusual behavior for his professor, and certainly an unusual smell. He decides to take action. The student checks the scene for safety. He also looks to see if there is anyone else around to help. There is no one. He makes sure there are no desks that could hurt the professor and no immediate sources of danger are present.
The scene is safe.
He then checks the victim by first obtaining consent. As he goes to the professor, he notices that he is conscious and he is breathing.
He is responsive and breathing. Professor, it's me, Nathan. Are you okay? I'm first aid, Aide, and CPR certified for children, infants, and adults. I think you may have food poisoning or the stomach flu. I am going to do a head-to-toe check and ask you some questions and make you feel more comfortable. I will see if you need emergency personnel or your family. Can I help?
Yes, help me.
The student practices standard precautions by putting his gloves on. His goggles, mask, and breathing barrier are not needed, but he keeps them close by. He begins by noticing his body is hot and sweaty. He then asks him how he is feeling.
Are you breathing all right?
Yes.
Are you feeling nauseous or dizzy?
Yes, some still.
Do you have any allergies?
No.
Are you on any medicines?
Yes, my asthma, my inhaler.
When did you last use it and how much did you use it?
It's been a few months actually.
Do you have any other medical conditions, Professor?
No.
When was the last time you ate or drank anything and what was it?
At lunch about an hour ago, it was a plate full of chicken I had. Come to think about it, it was still a little pink.
Do you think it was undercooked and how much did you eat?
Yes, I do, and I ate a whole thigh.
Did you just get sick or have you been like this for a while, Professor? How were you feeling after you ate?
Right after, I felt fine. I felt a little hot about 45 minutes after, and then the dizziness and vomiting, I never got. The vomiting started, I never get sick. I've been healthy for years.
The student decides it is food poisoning, and although the professor is alert and seems stable, he decides to call poison control just to see what they say.
I will call poison control.
Poison control tells him that he should treat it like the flu unless symptoms worsen and to see his family doctor because they might prescribe antibiotics of some kind. He can and should drink lots of fluids like water to prevent dehydration, looking for signs of weakness, dizziness, thirst, decreased urine output, and changes in heart rate. And they also said that if he is dizzy or vomiting, he should not be driving. The student tells the professor what poison control said and gives him a glass of water, telling him to sip it slowly.
Sip it slowly.
He then tells the professor he will perform a head-to-toe examination.
I will provide care with a head-to-toe exam.
He begins by checking the professor's head for signs of injury, including bleeding, cuts, bruising, or swelling. He watches the professor's face as he feels for signs of discomfort. When he reaches the stomach, the professor winces.
Does your stomach hurt?
Yes, a bit.
Is the pain achy, sharp, or throbbing?
Achy and sensitive.
Okay, I won't touch it again.
And the student continues the check. He asks the professor to wiggle fingers and toes as he comes to them. The professor misses the trash can at one point and throws up on himself. The student grabs paper towels and a wet one for his forehead to cool him down and clean him off.
Who can I call to pick you up?
My wife works on campus. Here's my cell.
The professor hands the student his cell and he calls his wife, explaining the situation and their location. He stays with the professor and continues providing water and monitoring until she arrives.